Introducing Perio-Mate from NSK. Introduction and unboxing. NSK's Perio-Mate is an air polishing handpiece for cleaning both sub and supragingival tooth surfaces. With Perio-Mate powder, it can remove plaque and eliminate biofilm quickly and efficiently. Perio-Mate is available in 3 different backends: NSK and KEVO backend models to connect to those couplers, and a direct connect model for all M4 connections. Today, we will demonstrate with the NSK backend model. In this video, we'll explain the contents in the package, the operation of, and before and after use care and maintenance for the device. Let's begin. Here's what you'll find inside the box: handpiece, powder case with its cap, spare powder case cover, spare O-rings, maintenance kit. The maintenance kit includes a cleaning file, small and large cleaning wires, a cleaning brush, tip remover, ring wrench, a little oil container, and a blower nozzle which fits the type of back end of the handpiece. First time setup. Make sure the air pressure is set between 43 and 58 psi and the compressed air supply is dry and clean. Water or oil content can solidify the powder and cause clogging and result in the malfunction of Perio-Mate. You can use NSK multi-gauge to check the supply pressure. Here's the regular before use routine. Thoroughly dry the coupler, handpiece, tubing, joint section of the powder case, inside of the powder case, and inside of the powder case cap. Connect the tubing to the coupler and insert it into the powder case. In case of a direct connect model, the powder case screws directly into the tubing. To connect the handpiece to the powder case, pull back the handpiece release collar on the powder case and push the handpiece straight onto the connection, and release the collar once the handpiece is in place. Pull the handpiece a little to make sure it's securely connected. Put on the cap and test the handpiece away from a patient before use. If any vibration, noise, or blockage is detected, contact an NSK authorized dealer or NSK service center for troubleshooting. Remove the powder case cap and fill the Perio-Mate powder up to the max line. That's about 10 grams of powder. Use only Perio-Mate powder, part number Y900938, and pay attention to the expiration date on the powder case to avoid any risk for the patient or the handpiece. Perio-Mate powder has the proper particle size for this handpiece and is formulated specifically to work with it. Securely close the container lid and close the powder case cap. Note: if excess cleaning powder is put into the powder chamber, the correct amount of powder will not be sprayed immediately. Fill the chamber slowly and avoid scattering the powder. Immediately clean any powder stuck inside the powder case or on the threaded portion of the powder case cap, or it will be difficult to close the cap. Operation with nozzle tip. Securely attach the nozzle tip to the nozzle. If the tip is inserted incorrectly, it may come off during the operation and cause an accidental ingestion. After filling the powder, spray it into the cuspidor or a sink for a couple of seconds and make sure it has a proper mix of both water and air. Insert the tip 3 millimeters or more into the periodontal pocket. If it's inserted less than 3 millimeters, powder may not be sprayed in the pocket efficiently. Start operating and spray the powder in the same periodontal pocket, moving the tip back and forth horizontally for up to 5 seconds, or a total of 20 seconds on all surfaces of one tooth. The magic number is 5 seconds per tooth surface. Do not exceed this time and do not force the tip into the periodontal pocket. The tip must be directed toward a tooth surface and not the soft tissue. After treatment, remove the nozzle tip from the handpiece using the nozzle tip remover and dispose of it. Each tip is a single-use product. It cannot be autoclaved or reused. The powder spray volume can be adjusted using the flow adjustment ring. Start by setting it to minimum and then adjust it according to the application or patient's conditions. Note: do not use Perio-Mate in the same area immediately after scaling treatment of a tooth surface in a periodontal pocket. Make sure to use enough suction to prevent a patient from ingesting a large amount of powder. Keep the suction near the nozzle until the end of powder ejection to avoid having the patient swallow it. Avoid continuous use of Perio-Mate for a long period of time. Allow the patient to rinse out as necessary. Operation without nozzle tip. Perio-Mate can also clean supragingival tooth surfaces or around the gingival margin without the nozzle tip. Remove the nozzle tip from the Perio-Mate handpiece and perform cleaning. Keep the nozzle about 10 millimeters away from the surface of the tooth at 30 and 60-degree angles. Do not spray the powder directly into the oral mucosa, and do not insert the nozzle into the periodontal pockets. Care after use. Note: failure to clean Perio-Mate after use and regular maintenance may cause powder blockage, water leakage, or malfunction of the instrument. After removing the remaining cleaning powder in the powder case, close the cap and run Perio-Mate with air only to discharge water and powder in the nozzle. Open the cap and blow off the remaining powder in the powder case with air. Fit the supplied blower nozzle to the coupler and attach it to the handpiece. Run idle with no water for more than 5 seconds to clear the lines. Use the blower nozzle in the same way to clear lines in the Perio-Mate nozzle. Hold the nozzle tight and blow air from the far end of the nozzle. Wipe the nozzle and the handpiece with a soft cloth soaked in alcohol to remove saliva and other physical contaminations. Deep cleaning and washing. Once a week, after removing the remaining powder, clean and wash Perio-Mate using the following steps. Remove Perio-Mate from the tubing. Disassemble the handpiece, powder case cover, and its cap. Clean the inside of the joint section of the handpiece and the O-ring section of the powder case with the supplied cleaning brush carefully. To remove the nozzle, insert it into the ring wrench and loosen the nut. Pull out and detach the nozzle from the handpiece. Clean the inside of the nozzle and the handpiece with supplied cleaning wires. File and brush away the residues. If powder is stuck to the O-ring section, remove them and clean the O-rings and grooves carefully. Rinse all the parts under running water. You can also perform ultrasonic bath cleaning with hot water. Blow water off all the parts and pieces such as case cover, handpiece and nozzle, and let air dry. Reassemble. Troubleshooting. Powder clogging. Remove the nozzle from the handpiece and clean the inside of the nozzle and the handpiece with the supplied cleaning wires, file, and brush. After removing the solidified powder, perform deep cleaning with ultrasonic bath from earlier in the video. Water leakage. Replace the O-rings at the handpiece joint section after cleaning and drying the grooves. Apply a drop of the little oil container supplied with the kit and rub it in with your fingers. Final reminder: keep the quick guide and the operation manual handy for future reference. Don't forget to clean the parts in ultrasonic bath once a week to avoid clogging of powder. Thoroughly dry the inside of the powder case and the connection parts after each maintenance process. Sterilization. Autoclave sterilization is recommended. Remove the nozzle tip. Dispose the remaining powder in the case. Disassemble and clean Perio-Mate thoroughly as instructed before. Insert sterilizable components into a U.S. FDA-cleared sterilization pouch compliant to ISO 11607-1. Seal the pouch. Use this chart for temperature and timing. Immediately after the sterilization cycle, remove the products from the autoclave and store in a clean, dry location. If you have any further questions, please visit our support site, nsktech-us.com.